Namaskar, myself Dr. Vishnu Shankar Shukla, nephrologist, Awadh Kidney Care Clinic, Lucknow. Today we shall discuss about some common and early signs symptoms of the kidney disease. And these are important because by this we can prevent the kidney disease progression if we detect the disease in the early phase. So we shall discuss today. They are very important and two keen points. So first of all, there is if the patient is having fatigability and weakness, like he feel weak, fatigue in doing early in the work, that's called easy fatigability, and this is because of the uremic toxins and low hemoglobin level in the body. The other symptom is swelling, especially over the face and legs, that's called pedal edema and facial puffiness. This is an important significant feature, especially in case of the glomerulonephritis, whenever there is loss of the protein in the urine, and that leads to the edema. And this can happen mostly in the night or early hours in the morning. When a patient get up, he feels there is puffiness over the faces, over the periorbital area, around the eyes, and especially in the evening time, he feels this edema over the legs. That is called pedal edema, and that is because of the collection of fluid and salt in the this compartment. That's called pedal edema. The other symptom is feeling of nausea and vomiting. This is important, and it sometimes when patient starts having this kidney disease, kidney failure, then patient may develop this feature, and this is because of gastritis and also due to uremic toxins which affect our nervous system in the brain. Then another symptom is this is called poor appetite, and this appetite loss is very important feature. When there is progression of uremic toxins, increase the urea, creatinine, other toxin, that leads to the loss of appetite. And this is because of the effect of uremic toxins over the brain, over our satiety center, and then again due to the edema in the gut wall, in the stomach, that also lead to the loss of appetite. That is because of the important feature of renal failure, and sometimes it happens early also in the kidney disease. Then very important features which we find in our urinary system, whenever the patient is having increased amount of urine, like patient has multiple times urge of the urination, especially in the night time, that's called nocturia. Patient awakes and goes for urination many times in the night, that's called nocturia. So that is very important feature of the kidney disease. Again, if the patient is having feeling of frothiness in the urine, means the urine is frothy, it is sticky, and it is difficult to flush out in the pan, so that's called frothy urine. Again, if the patient is having red color or cola color or a smoky urine, that's called smoky urine or hematuria, and that gives a clue about the kidney disease, especially glomerulonephritis. And again, we have our discussion over the hematuria or blood in urine in our previous slides, we can see. So these are important features related to the urine of the kidney disease. So there can be frothy urine, there can be dark color or cola color or urine, that's called hematuria. Again, there can be increased frequency of the urine, especially in the night time. Again, patient may have itchiness over or dryness of the skin, that is usually feature of moderate to advanced renal failure because of deposition of uremic toxin in the skin dermis, that leads to the itching or the dryness of the skin. So these are very important signs and symptoms of the kidney disease, and we can get pick these symptoms early, and we can prevent, if we get attention, the advancement of the renal disease. So kindly have the information and distribute to others also. Take care. Thank you. Namaste.